Well, good afternoon and welcome to the Small Business Briefing. It is Thursday, September 9th. I'm Rob Fowler, the CEO of the Small Business Association of Michigan, and Brian Calley, president of SBAM, is my co-pilot. This briefing is brought to you by the Marana Group, a data document and distribution solutions company. Marana Group offers a full line of solutions designed to help get your company's message in the right hands in a timely and cost-effective manner. You can find out more at their website at maranagroup.com. Brian, it's not Data Monday. In fact, we weren't here Monday because of Labor Day, but there's an interesting thing happening in the trends that I think is worth at least talking about, and then we'll unpack it a little bit more next Monday. But just, what do you see in the numbers right now?
Yeah, I don't have any graphs or anything to share, but just to kind of characterize it. Last week, a week ago today, I had mentioned that it looked like things were starting to plateau a bit. And then the next time the data was reported on Tuesday, it actually showed that the numbers come down. So the positivity rate stayed about the same. The overall numbers went down. Now, holiday weekend, the numbers, did everybody really report? Did the who goes and gets the tests and, on the last weekend of summer. So, there's a lot of other factors that aren't normally there. So, you try not to get your hopes up too much when it looks like, hey, we got out of it with a really small wave this time. And then so when another update came out this week, they looked a little bit higher. Still the trend on the 7-day average looks like it's plateaued. Maybe it's coming down a little bit. And the hospital numbers look like they're plateauing or very slowly increasing as well. So good sign. Now the positivity rate hanging out at 10% is that's concerning. You could see that it's pretty high. So you could see there's lots of seeds being planted out there, and it could take off. You remember last year it wasn't until October that we had the more serious wave that led to overcrowding in hospitals. And so the hospital census nowhere near as high as it was a year ago in the fall, but who knows? I mean, it could. We're not out of the woods yet when it comes to our risks with respect to the virus and the possibility of a fall wave.
Earlier today, we did a press conference, if you will, with the Michigan Health and Hospital Association, and they were talking about some of the numbers that you just mentioned, and raised the issue of what they called a twindemic. Not only the numbers with regard to COVID-19, but it's flu season, and the concern that we're going to see some flu numbers really rise up, and those ICUs are going to be full once again with the combination of COVID and the flu. We've been watching vaccine numbers, and that the press conference today was really, again, our continued trying to voice that it matters to small business for people to get vaccinated. It matters to our economies. It matters to our communities, and so trying to help again with that. The University of Michigan study just came out that really got at this issue of what is the combination, if you took those who've gotten a vaccination and those who have natural immunity from having the disease. What does that tell us about how close are we to herd immunity?
In the beginning of the pandemic with the original strain, the idea, there were a lot of the epidemiologists, it seemed to be a consensus around 70% of the entire population. So not just 70% of the adults, but 70% of the entire population. If they had immunity, that would be herd immunity. With the Alpha variant and now the Delta variant being more contagious than the others, it'll take a higher number. I've seen estimates around 80 to even 90% needed kind of internal protection to hit that point of herd immunity. So and regardless of the public policy argument about, should natural immunity count or not, the good news is natural immunity appears to be pretty effective. And we don't know how long it lasts, but we also don't know how long vaccine immunity lasts. So But so there's still some questions out there, but the fact that that natural immunity appears to be enduring is an important factor. And so when the University of Michigan did some estimates on, we know about how many people have had the virus. We know about how many, well, we know exactly how many people have had the vaccine, but we don't know how much overlap. You can't just add one to the other. And so the U of M has estimated 68% of the total population has some form of immunity in them, or the antibodies and necessary to fight serious illness with the coronavirus. So that's pretty good, some really strong progress. That doesn't mean that people can't still get the virus, but it does mean that that their case would be less serious than otherwise would have been if they get the virus in the future. And so that's that's pretty good. I mean, that's but now, given the fact that we still see waves in the South, we just saw hospitals get overcrowded again. We know that this, just as often happens, that viruses want to survive, and so they mutate to become more contagious, and this one has. So that target number would need to be something higher than 68%, or because we saw how it affect the southern states. So in terms, we started out talking about the numbers and kind of a plateau. We saw a plateau at a lower level last fall, and it lasted right through October. And so that's why I still, I still feel like that these numbers, and looking at what happened in the South, when it truly gets cold outside, and kids are back at school, it's cold outside, more people indoors, then I wouldn't be surprised if we saw something of a resurgence at that point. But every time it happens, there is additional immunity that's built up in the population. I kind of suspect that if you look at a map of the United States, Michigan has one of the states with the lowest numbers of coronavirus in the country right now. I think that the difference between us and most of the rest of the nation is we had a really big spring wave of infections. And so we've made good progress on vaccinations. You put that together with a big spring wave with recent natural antibodies in the population as well, and it's probably holding our numbers down right now compared to some other places.
Yeah, it's a little hard to talk about this in apples to apples kind of comparisons. That 68% number is the entire population. And I don't know how you would get from that to 16 and above, but we've been talking about 70% for those who are 16 and older, or 18 and older, depending upon whose data we're using. Would you hazard a guess at what percentage of that adult population must have immunity one way or the other if the entire population is 68%?
Well, they didn't break the number, or at least in the summary that I saw, it didn't break it down in that way. But we do know that overall, about half, 51% of our population, which is mostly adults that qualified or approved to receive the vaccine, about half of the adults are vaccinated right now. So we do have, that's good. That is good progress in a short period of time. It still puts the U.S. at a high level compared to a lot of other nations around the world. But we have seen other countries now. We got off to a fast start. Ours is plateaued. Now it's slowly rising. But other developed countries are now really passing the U.S. by in terms of overall vaccinations. We'll be able to watch those and see the difference that it makes, in terms of what happens with hospital census and so forth. Because, the risks in the hospital, we're kind of trained to think in terms of, what is my personal risk with COVID-19? But no matter if you need to use the services of a hospital at a time when the hospital is very crowded because of COVID-19, then you have other risks now in play. Doctor and nurse fatigue. You have secondary infections from being in the hospital itself while you're in for another reason, postponed non emergency services being postponed because they don't have enough staff to deal with everybody at the same time. And then people just putting off healthcare services when waves are happening. Like, that's where the sick people are in the hospital. I don't want to go there. And so putting off until they're very sick for things that have nothing to do with COVID-19. So there are a lot of ramifications in hospitals, and why the question about overcrowding hospitals is, it's not just about people getting the coronavirus and whether or not they can survive. It's the impact that it has on all the other things that happen in our healthcare system.
Right, right. Well, while we're talking about this, the vaccine is one thing. People are beginning to ask the question about boosters. The Biden administration recently said that they would like to begin boosters for the general population sometime later in September. And it caused an interesting reaction at the FDA, who felt as though maybe that wasn't yet timely.
Yeah, so this was kind of a surprise. You had two high-profile resignations in the FDA tied to the decision, the pressure by the Biden administration to get boosters approved. Now, some other countries have started to move forward with boosters. Our country already has for those who are immunocompromised. In a much wider scale, it's happening in Israel, for example, right now. It's difficult to tell whether the problem with the approval is because they feel it's not tested enough to know if it's necessary. I haven't seen anybody who has suggested it would be harmful, but the idea of, is this necessary or not? Or is it because the US is way ahead of most underdeveloped countries, or all underdeveloped countries, in terms of access to vaccines? And how can Americans take a third shot when a bunch of other places haven't even had their first? So it's difficult to tell, the kind of whether it's a political issue or a scientific issue that caused those resignations. But clearly, there's dissension about this question on whether or not it's time yet to move forward on boosters outside of those who have immunocompromised type of conditions.
Yeah. All right. So earlier this week, the Michigan Department of Health and Human Services created some new guidelines for schools, and mostly around the issue of quarantining. It's interesting, in the press release, it talks about adding some clarification. I think that's a word I wouldn't use. Having read this new guidance, it reads a little like a "Who's on First" comedy routine. What, in essence, were they trying to say to schools, and what kind of guidance is this?
So I know what they're trying to do, and then we'll talk about what it actually does here. But what they're trying to do is to create an incentive for schools to have mask policies. So they're saying that, if everybody masks at a school, then the quarantine requirements are less in the event of a close contact. And so, but this kind of reminded me of the early days of the pandemic, when these orders were so confusing. And just maybe out of appreciation, our audience is obviously mostly not schools, but businesses that have had to deal with confusing orders in the past. So here, just a couple of items here. If everyone is masked and the students stay within 3 to 6 feet away from the infected student, then the exposed kids, the close contact kids that had close contact, only need to monitor symptoms for 14 days, so they can still go to school. But if everyone is masked and the students were less than 3 feet away, the exposed students should either take a daily COVID test for a week and monitor symptoms for 14 days, or the exposed students should stay home for 7 days. They can return to school in a week as long as they get a negative COVID test, and he or she doesn't take a test, they can return in 10 days. And now I'm not going to go through the whole. I just gave you 2 of the bullet points. There's a bunch of them, and it's just like I looked at this and it gave me it gave me some flashbacks to the orders before, and how important it is that we don't have those for business in the future, and that we've gained a lot of experience in operating in this environment, and we cannot go back to those kinds of orders. In schools, there's a lot of debate that's happening right now. The state has still maintained that there is not going to be a statewide order saying how schools had to handle things, but there are plenty of county health departments that have issued orders, and it has come with a lot of debate and controversy. But at least it's the decisions being made at the local level.
Well, it matters to small business for a lot of reasons, not the least of which are parents of school-age kids able to go to work and feel comfortable their kids are learning, and not trying to manage their remote learning. It's so disruptive to the private sector workforce. But I think the other reason, I think we all knew that there was some learning loss going on. Nobody thought not, but we've now seen the evidence of that. The M-STEP test results have come out, and we can see pretty much across the board that there has been some slippage.
There has. It was particularly acute in in math, and so according to the 2021 results, which, by the way, a lot of students didn't take it. So these are the students that take it, that took it, fewer than in previous years. My guess is that the ones who took it are actually higher performers than the ones who didn't. I don't have much to base that on, but it just seems like, if you're going to go through that test, you're probably confident, or more confident. I don't know. I could be wrong about that, but but according to 2021 results, the scores dropped in some cases very significantly for every single grade tested, and they test math from 3rd to 11th grade. Every single one of them had declines, and I suspect that it doesn't show the whole picture of what the declines were, because of a relatively small cohort of students did the testing this year for the previous year. So learning loss is going to be a big problem. It's one of the issues, one of the areas of the pandemic that we're going to have problems on into the future. So we already have a scenario where graduation rates are relatively low compared to a lot of places around the country, and then the gap between high school and that next step of education, whether it's community college or university, that there tends to be a gap for many. I think most students that go on, and so that gap is going to be harder now, and it's why it's that much more important that schools have to stay open. The kids have to continue the process of education. We need the stability for our workforce, but we need a talented workforce of the future. We have a lot vested in this, and I think that it's one of the areas where Rob, you personally are very involved in education policy and moving forward in a way that elevates the entire system. That lift got heavier in the last year. Clearly got heavier in the last year.
Yeah, sure did. Hey, let's talk about a couple of things. That's one of the sort of effects of the lingering effects of this pandemic. We heard last week, I think, that General Motors is essentially idling for a week or longer plants across the country, including in Michigan, because of the chip shortage and their inability to get sufficient supply of chips.
Yeah, and this is a problem that some believe it's going to take upwards of a year or more to solve, and so there's these intermittent interruptions in production while the supply of chips can catch up to the production of vehicles. So about a half a dozen plants for General Motors are being idled, including one in Lansing, and for 2 weeks, and we probably have not seen the end of that. Some of the economic forecasts are, just looking over, if you've got an economy that is dependent on automotive, which of course we do, that this has a ripple impact across the whole system. So, and the chip shortage, while it's technically a direct problem of the automotive industry, I think that we should expect that when the automotive industry has some struggles or doesn't do as well, then it could signal that there's a bit of a softening in our economy in general. So we're not as dependent as we used to be on the automotive industry, but clearly this chip shortage is having ramifications beyond just the sale of new cars.
In fact, one of the interesting sort of reactions to that, fewer new cars being sold, more used cars being sold. And one of the areas that's sort of booming right now is the aftermarket market for used cars.
Yeah, if you look at the consumer price index and you see these big categories of items that are rising in cost or in price, used vehicles is one of the big ones. That's the value of a used vehicle is a lot higher. And because new cars aren't available, people are driving older cars longer. That means all the things that go into used cars to make them run longer the demand for those is increasing as well. And so that is the automotive aftermarket, everything from parts and components to the sales of vehicles themselves, really hot. I mean, there's a lot of action there, and it's I don't know if we've ever talked about this. I drive cars. If I get a car, I drive it until it literally just won't go anymore. I don't stop using cars until I have no other options but to get a different car. And so putting more into vehicles and keeping it up. I noticed even just I had to replace a battery in my vehicle the other day, and it had been 2 years since I'd had in a different vehicle a battery need to be replaced. I was kind of shocked at how expensive it was. I do it myself. I just go to the store. I got a great automotive supply store in little town where I live, and was kind of surprised at what a battery is going for today. But it came on the heels of reading that article about the demand for everything it takes to keep used vehicles going, getting them ready for sale, or somebody who just can't get a new one right now is to keep their older car going for longer. It's created opportunities. So it's one of the things. Everything in the economy is connected, and so one area kind of gets pushed here, it pops out someplace else. So it is good that it's creating some opportunity for others.
Yeah, absolutely. We're seeing a kind of inflation. We've been talking about it. We'll continue to talk about it, and I think bring some programming to the table. I had an experience over the weekend. Went in without really looking at the price of it, and got 2 steaks from a butcher shop with $77 for 2 steaks. And I almost went back in thinking they had mispriced it. It was such a shocking increase in the price.
Well, we had a member share recently about they buy a restaurant buys chicken, and a box of chicken was basically doubled. It used to cost $40, now it's like $80 or $82. But those kind of cost increases we see happening across the board in almost every industry, or every industry that we've checked. We'll have a survey going out here real soon. We were just today working on the updated questions, and we want to dig into both how HR practices are changing, but also the challenges and rising costs and what people are experiencing, partly to bring attention to policymakers that are continuing to spend and propose to spend at unprecedented levels, seemingly oblivious to the risks of rising costs and inflation, but also to better inform programming around managing a business through a significant rising cost environment where those costs are rising significantly.
So a related topic, the August numbers came out for labor market. Really kind of a weak labor report, and certainly weaker than was expected.
Yeah, one of the weakest that we've seen in the last year. So we've seen, really strong job market performance, and the August numbers were very disappointing. A lot, and when I say disappointing, still up 235,000, but a lot less than what was predicted. And it probably not a surprise that the areas where that were down were the areas that have that face-to-face type of interaction. So, restaurants and bars, retail type businesses where people are doing in-person work. And, there's a lot of things that could be happening there. It could be that businesses are figuring out how to operate with fewer people and therefore are hiring less, or it could be that they're giving up on finding people because it's been so hard. As of last weekend, the unemployment, the federal unemployment support, $300 per week, in addition to the state support, that the federal part of it ended, and the number of people that were eligible for unemployment overall went down by about 400,000, and then there's another 100,000 people, but they're back to the $362 a week maximum. And so hopefully that will make a difference in the availability of people out there in the workforce. But looking at the August numbers, it could be that some people have kind of missed the boat. That the opportunity that was there a few months ago, because that didn't get filled, there's nothing to say that those opportunities will just be there when people are ready to get back in the market.
Yeah. Let me raise one more issue that I think is, when you put these together, it sort of begins to paint a picture. I think we've all seen videos of people, not generally in Michigan, but literally filling a grocery cart and walking right out of a retail store untouched, shoplifting. And we've heard stories more recently about what is essentially people stealing from retail and selling it on Amazon. And it's sort of a crime that's happening out in the open.
Yeah, this was actually quantified recently. Kind of a staggering number: $45 billion a year in this type of retail fraud, where people will steal from a retailer and then sell it on a platform like Amazon. And the idea of peddling stolen goods out of the trunk of a car, which is back in the olden days, I guess how it would happen. But now there's an online market, and so it's creating a real we see these anecdotes in social media, and there'll be some security footage and people just walking out, and most retail operations don't have security, and the person working the cash register is not a police officer. So even if you see somebody stealing, it's not like there's an intervention going to happen with the current staff. And depending on where it is, it's not necessarily something that police can immediately respond to. So it's given way to something very substantial. But this revelation that it's about $45 billion a year in our country, that's really, really something at a scale that was at least surprising to me.
Yeah. All right. Well, that is what we have for you today. A couple of reminders for things upcoming. We have I'm going to call it a non-webinar. It's a online discussion in a webinar format. It's called The Great Resignation, an open conversation about how to keep employees in 2021. This is sponsored by Hayworth, and a couple of our past board members will be facilitating that conversation. That's September 22nd at 10 o'clock. Also, we are accepting applications for what is called the Rick Snyder Spirit of Entrepreneurship Award. This is an award given annually to a small business. We're essentially looking for a turnaround story. We put this, created this award in honor of Rick Snyder and Brian, you and he, and the turnaround that our state made. So it really was so we don't forget what a policy-driven economic turnaround looks like. And so we're looking for a turnaround story. If you know of an entrepreneur who's had a pretty significant change of fortune because of things that they did in strategy or in pricing or whatever they did to make it a turnaround. That's the story we're looking for. The application deadline is September 17th at 5 o'clock. You can find out more on our website and in the link today. So thanks for joining us. We'll be back here on Monday at 3 o'clock. We'll see you then.
See you Monday, and I'll have the data.